This machine is the Heidelberg HRA spectralis. This takes fundus pictures, and we use it for our fluorescein angiogram injections. So to start, we'll go to the coins here. You can either add a new patient by going to the new patient icon, or you can search for an existing patient. Once you find your patient, you'll highlight their name, and then you can go to new examination. It'll ask you if you want to examine the patient. We'll click on yes. Device type will be the spectralis HRA, and then your initials. And then all this eye data you can leave the same, just hit OK. So we'll be using this touchpad over here. So once you enter the information, it'll be calibrating, and then when this turns yellow, we can press this button to start the exam. So to get a regular fundus photo, we're going to click on the IR, and then this is our light source here. So if we want them to look straight ahead, so we'll click the center square there. So now we're ready to get our fundus picture first. So this camera moves around. We're going to keep it straight for now. On the screen, we're going to find that little light source, that circle there. We want that centered. And then we'll just go in towards the patient's eye. So you want to fill that light with the entire screen. You see that it's so bright, so this is our light source here. We're going to just turn this light down. Now on the screen you see that's much better. So you want all those corners to be nice and clear, no shadows. And then the last thing before taking the picture is you want to focus it. So this knob here, we can focus the image there. So we'll do big turns to see now that's blurry. Clear, other way, it's getting blurry. So we're looking at the center of the screen to be nice and clear, which right there looks pretty good. So we're going to hit this black button to track it. On the computer, we'll see this top left corner here. So it's getting a better quality image, and then we'll click on Acquire. After you get the fundus, you want to do a autofluorescent photo. So we're going to click on the FA button. It'll be very bright for the patient, and this will look behind the retina at the choroid layer now. So we'll press FA. We're going to increase the brightness. This patient is not dilated, but you can see all the vessels and the optic nerve right there. So again, we're going to hit the tracking button, acquire, and then untrack. After this, the patient will sit back, and this is when you'll do the injection. So we're going to inject the fluorescein into the patient's vein. After it's injected, the patient will come right away into the machine again, and then the technician will click on the injection icon. Very important to click on this. This will start the timer. So on the screen here, it gives you 3 seconds, 4 seconds, so that's the timer there. You want some early shots first, so you want to get within 30 seconds, about 2 photos for each eye, then about 1 minute, and then every minute afterwards. If they have wet AMD, we want to see if the fluid is building up underneath the retina, so you'll be seeing some brighter white spots in their retina. If they have dry AMD and it just drews in, you'll see that over 3, 4, 5 minutes that those spots are just staining and they're not getting any brighter. So the patient, after we inject, will come back in. We're going to keep it on the FA setting, and then we're going to just find that white spot on the screen there, go in towards her eye. So there's no dye in her eye right now, and you can tell because all those vessels are black. But if we were to inject her, all those vessels will now turn white, and then the background actually switches the contrast, and now the background becomes black. And then from there, we'll get a series of pictures by just clicking on this to track. We'll look at the screen there, and then we'll click on Acquire. So we'll do that, a few pictures for each eye, just to see the blood flow as time goes on.